it's just a great opportunity to help solve the workforce challenges that we have and have a win-win from an immigration standpoint and from a healthcare workforce standpoint.
Welcome to Off the Chart, a business and medicine podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. This week's episode features a conversation between myself, medical economics assistant editor Austin Luttrell, and Dr. Tom Price, an orthopedic surgeon who most recently served as the 23rd Secretary of Health and Human Services. We're talking about the physician workforce shortage and how policy changes around employment-based immigration might offer a solution. Dr. Price, thank you so much for taking the time and joining me today.
You bet, Austin. Thanks so much. Good to be with you.
We're in the middle of a serious healthcare workforce shortage. I mean, that's no surprise to anyone. One idea that's been getting more attention is using legal employment-based immigration to help fill the gap. So ahead of this interview, your team pointed me in the direction of a staffing stream piece by Ron Hoppe, who's a longtime international immigration professional who says that thousands of qualified international clinicians, that's physicians and nurses, are stuck in visa backlogs even though they're ready to work. Considering your background, I mean, not only as the former secretary of HHS, but even just as a physician, I mean, I'd love to get your take on this. So I guess just starting with some background, could you talk about some of the biggest barriers that are standing in the way of solving the shortage as it is now?
Yeah, this shortage in healthcare workers has been going on for a long time, decades. I was in medical school in the late 70s, and at that time we were beginning to have challenges in certain areas of healthcare, mostly on the acute side, but some on the chronic side as well. So this is not a new challenge, and it doesn't take a genius to figure out that there are significant problems when you look at whether it's in the acute setting in a hospital where they can't where beds can't be staffed, and so wings of hospitals are closed, or in skilled nursing facilities or nursing homes or long-term care or home health or physical therapy, all the kinds of things that people need to stay and remain healthy. There are challenges from a workforce standpoint. Now, people say, "Well, why would you want to use folks who aren't born here in the United States?" And the fact of the matter is, we're currently doing that and have been doing it for ever since the United States healthcare system began significantly. So there are about 15 million healthcare workers in the country. About 20% of those are non-U.S. born folks. They're immigrants who've come here either as kids or later in life. Many of them have had their education or their training here, and they fall in love with the United States and they want to stay. So about 20% of the 15 million are non-native U.S. born workers. In addition to that, there are about 1.5 million students, foreign students in the United States studying some sort of healthcare work. And what we do in the United States, sadly, is that they finish their training, they finish their education, and then we tell them to go home instead of saying, "We'd love to have you stick around and use your expertise that you've learned here." So a lot of barriers in the way. Some of them are immigration, some of them are just kind of inertia of where the system's been. Some of them are across folks who aren't native born United States people in the healthcare workforce. Some of them are unique to the immigrant population, but it's just a great opportunity to help solve the workforce challenges that we have and have a win-win from an immigration standpoint and from a healthcare workforce standpoint.
Say, Keith, this is all well and good, but what if someone is looking for more clinical information?
Oh, then they want to check out our sister site, patientcareonline.com, the leading clinical resource for primary care physicians. Again, that's patientcareonline.com.
Could you talk about maybe other specific federal or state policy changes that would really effectively, address this issue?
Sure. If you look at and the president has talked about this, and a bipartisan group of folks in Congress have talked about it through either the Doctors Act or other pieces of legislation that exist in Congress for providing healthcare workers for rural or underserved areas. But if you look at merit-based visas, so that you have folks who have a talent, have an expertise, have an education, have a profession that would be helpful to the United States from a healthcare workforce standpoint, we ought to be expanding those numbers. And many of those pieces of legislation do just that. Whether they require individuals to go to those underserved areas or the rural areas, or whether they're just allowed to work wherever the need arises here in the United States. But a merit-based visa program would be incredibly helpful, and it would just be adding on to the current system that we already have, but expand the numbers.
So in that piece, there's you mentioned there's thousands, tens of thousands of physicians and nurses who, even though they've passed U.S. Licensure exams and completed immigration requirements, I mean they're kind of sitting in almost a queue, right? Like they're not
That's
able to
right.
enter and able to practice here. I mean, why is that the case?
Well, the federal government has for years, for both foreign-born individuals and for United States citizens, limited the number of, especially physicians, that are able to gain graduate medical education and training here in the United States, and that's a holdover from the fact that the vast majority of the graduate medical education seats, positions in this country are funded through Medicare. And so in an effort to limit the exposure of a liability to Medicare, the number of slots, the number of residency slots are limited in this country. In other areas, it's simply limited by the numbers of folks who are allowed into this country on a legal basis, from merit-based, or from folks who are trying to fill a workforce need in this area. So there are a number of different reasons for why this challenge exists. But the fact of the matter is that we could solve this relatively quickly from an immigration standpoint by moving toward a merit-based visa system that would then help significantly decrease the workforce challenges that we have, and also make it so that those individuals that are allowed into this country are folks that have a talent or an expertise or a profession that is drastically needed in the United States for our own citizens.
From your perspective, I mean, why hasn't this issue of legal skilled immigration in healthcare really received more attention in national policy, just conversations in general? I mean, what's missing from that today?
There's always something that's sucking the oxygen out of the room or pushing common sense things to the side. You have likely noticed that not many things are going through Congress right now. It's hard to get bipartisan cooperation. But this is one of those. This is why one of the reasons that I've been talking about this, because it's one of those areas that does have bipartisan support that could be able to pass through both the House and the Senate, and I believe signed by the president. And it solves one of those real challenges that we have. So why it doesn't happen is confounding, and was when I was in Washington, and continues to be from the cheap seats out here in the country. But it's important that people talk about it. It's important that our representatives and our senators know that there are specific programs that could be put in place that would help solve this challenge, and just keep talking about it, and hoping that people will pick up the mantle and run with it.
So you kind of touched on it there. I mean, it's important for people to talk about it. I mean, what role can physician groups or practices, or even just individual physicians, I mean, what role can they play in advocating for these changes?
Well, communicating your concern and the need for these workers is incredibly important. And so the hospitals are doing so, medical groups are doing so, medical organizations are doing so, state medical societies, specialty societies are doing so. And the folks that organize all of this to allow these folks who would be coming to our country to make certain that they do have the highest standards, that they do meet the educational requirements that we have here in the United States, and that their training is either comparable or they're shunted into an opportunity to be able to train further here in the States before they would go to work here in either underserved or rural areas, or wherever the need might arise. So mostly it's communications, education. It's just informing folks about the need for it. And again, it doesn't take somebody in the health sphere to be able to recognize that need. If you go into any nursing home or long-term care facility or skilled nursing facility or even hospitals now, you will notice that there are wings of those buildings that aren't being utilized often, and most often that's because of workforce. It's not because there aren't people that need a bed in that area.
Oh, you say you're a practice leader or administrator? We've got just the thing. Our sister site, physicianspractice.com, your one-stop shop for all the expert tips and tricks that will get your practice really humming. Again, that's physicianspractice.com.
Another main point really in that article is immigration reform isn't really about choosing between border security and workforce needs. I mean, both can coexist.
Sure.
Do you agree kind of with that sentiment that it can be aligned with broader border policy priorities, and really how is that the case?
Oh, absolutely. And in fact, it's part of the principle of what real border security is all about, and that is to make certain that folks are allowed to come into this country are ones that will be able to contribute to our society. And where else could somebody contribute more positively or effectively than in the area of healthcare? We are an aging population. We're a population that is significantly in need of healthcare workers. And so if we were to have a merit-based visa process for healthcare workers, then that helps to solve part of the challenges of the workforce, but also recognizes that there are principles involved from an immigration standpoint that ought to be adhered to. And merit-based immigration is one of those things that I think virtually everybody can agree upon.
Is there anything that I haven't asked you that we glossed over maybe, or something else that you feel is important about this topic?
Well, the only thing that I would add is that this isn't just in a small niche in healthcare. It's not just physicians that are in shortage. It's not just nurses that are in shortage. It's not just nurses aides or LPNs who are in shortage, or physical therapists or occupational therapists, or nurses aides in long-term care facilities or skilled nursing facilities or home healthcare folks. It's throughout the entire realm of our healthcare workforce. And so when people say, well, there's only there really isn't a doctor shortage. There is, but some people will argue that there isn't. It's just a problem of distribution. But there's a physician shortage, there's nurses shortage, there's other healthcare worker shortages, and it runs the entire gamut of the healthcare workforce. And people need to appreciate that so they can, again, articulate to their representatives and senators and governors and other folks at the state level that this is incredibly important and needs to be solved.
Absolutely. Great. Well, again, Dr. Price, thank you so much for your time today.
Thanks, Austin. Take care. Be well. God bless.
Thank you. You as well. Once again, that was a conversation between myself, medical economics assistant editor Austin Luttrell, and Dr. Tom Price, an orthopedic surgeon and former Secretary of Health and Human Services. On behalf of the whole medical economics and the physicians practice teams, I'd like to thank you for listening to the show and ask that you please subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts so you don't miss the next episode. Also, if you'd like the best stories that medical economics and physicians practice publish delivered straight to your email 6 days of the week, subscribe to our newsletters at medicaleconomics.com and physicianspractice.com. Off the Chart, a business and medicine podcast, is executive produced by Chris Mazzolini and Keith Reynolds and produced by Austin Luttrell. Medical economics, physicians practice, and patient care online are all members of the MJH Life Sciences family. Thank you.